When we think about doing risk assessment, one of the things, of course, that you want to ask about is the emotional impact of the pandemic on your patient's suicide risk. These are some of the possible risk factors. These are pretty well known: social isolation, social contact and sheltering together. What are the particular financial concerns? Worry about health or vulnerability in themselves or their others. Decreased social support, increased anxiety and fear. And importantly, what are the routines that have been disrupted? Is interpersonal conflict increasing tremendously? Is social isolation and feelings of loneliness increasing? What is actually changing in their lives? And are these having an impact on their feelings of suicidality? Okay, so this is really important. Reducing access to means. People have changed their circumstances, their living environment. Some people have moved to other locations. Some people are in a very packed environment. And so we have to kind of talk with them very directly about increased access to lethal means. This is particularly true because people have stockpiled medication. It makes sense that they have done that, but we want to inquire especially about Tylenol and other psychotropic medications, because we know that Tylenol is quite lethal. There might still be a way that somebody else can hold their medications or the extra amount of medications, even in this particular environment. You know, can be left at somebody's door, can be put in their mailbox, and then it can be brought back. So we have to really get creative. And then finally, we have to make sure that firearms, if present, are stored safely or temporarily removed. In terms of risk, in evaluating risk, the unfortunate part of that is that it really comes from knowing your patient really, really well, and from having a sense of trust that the two of you have developed together. One of the things that I have told patients when I work with them is like that I tolerate a tremendous amount of risk in my patients who I'm working with as outpatients, as long as I can, and will help keep you out of the hospital, which people do not want to go to generally, as long as I can trust you, as long as I can trust what you're saying. The way that I think about it is today's moderate risk is tomorrow's high risk, and that you are not necessarily going to be with the person when they flip from moderate to high risk, which is usually we think about somebody who has suicidal ideation with intent and plan. But what you want to do is proactively have them figure out where are they entering that danger zone and what to do when they are in that danger zone, because you're not with them all the time.